As you can see on this slide, we have a comparison between the symptoms of general influenza and COVID-19. And one of the struggles we're currently dealing with is there's a lot of crossover and similarities between the symptoms of both viruses, so it can be hard to tell which one a person has at a given time. Apart from the similarities in the symptoms, we're currently living through a pandemic, just like they were in 1918, infecting large numbers of people. We see the use of masks coming back to prevent the spread of viruses through respiratory droplets. And both are respiratory viruses that can then lead to later complications, such as fluid in the lungs and pneumonia. And the article I read in The Atlantic brought forth, of course, people are scared just as they were in 1918. There are a lot of differences, however, between 100 years ago and now. So at the time, we really couldn't see or name the disease. They didn't really know what it was. All of a sudden, people were just getting sick. It was actually called influenza, from the Italian word for influence, because the disease was thought to be caused from a misalignment of the planets. So the influence of the planets was making people sick. There were also theories about tainted Russian oats and volcanic eruptions causing the illnesses. So we didn't really know about viruses until 1933, even though scientists had found the bacterium that causes the 1918 influenza much earlier. And then in 1940, the electron microscope was available, so scientists were actually able to see and name the virus. And you often hear this disease referred to as Spanish flu, which is a misnomer because Spain was the only country that reported outbreaks at the time because they were neutral during World War I. So they were the only country that really wasn't being censored for any kind of military reasons. So Spain reported their outbreaks, thus they got saddled with the name. And we were actually able to reconstruct the virus in the mid-2000s after a decades-long project of trying to go back and recreate the virus to try to understand what exactly made it so deadly. Also in 1918, we're in the pre-antibiotic era, so doctors weren't as well able to help treat patients at the time. As you can see from the image in this emergency hospital, there was a lot of crowding, which was a general problem. There was a lack of treatments available to patients, and just general crowding in everyday life led to the disease being able to be spread much more quickly. So comparatively now, we know a lot more about COVID-19, even though we're still learning. We can see it, we know its origins. Within 2 weeks of discovery, scientists were able to identify it as a coronavirus, so a similar kind of virus to the common cold. And they were then able to sequence the genome and determine that the likely host was bats. And this information was all shared to help promote research towards finding treatments and finding hopefully some kind of cure for it. We have antibiotics now as opposed to in 1918, but antibiotics only really tend to help with infections that result from the virus. Although we also have antivirals that some can help. There's some evidence that suggests there might be some help in certain ones. It's likely that pneumonia was the cause of a lot of deaths in 1918. So people ended up with pneumonia after being exposed to the influenza, and that was really fatal at the time. Also, we have more specialized doctors with specific training, usually working in teams. A lot of times in the early 20th century, the doctor who set your broken leg was the same doctor who would treat your stomach flu, which is the same doctor who would treat whatever respiratory illness you had, which made it really hard to have that kind of care we have now. So now we have more attention to patients being split between professionals who are trained within specific disciplines. So doctors take care of one aspect of care, nurses tend to do a lot more of the everyday stuff. You have respiratory therapists who focus specifically on working with patients who have respiratory problems, which means then that the patient is more likely to survive. And there's also more isolation in medical facilities now that helps keep preventing the spread. And we see the resurgence of PPE in medical facilities, more common than it used to be currently. So one of the questions I wanted to analyze while working on this was what made this particular bout of influenza so bad. We actually know it was an H1N1 virus, so similar to the H1N1 outbreak we had a few years ago. But what made this one in particular so bad? Well, some of the societal factors were there was increased travel compared to times before. After we kind of hit the Industrial Revolution and cars and trains and international travel was a lot easier than it had been previously. So people were able to travel more, which meant they were able to then spread the disease more. And World War I was a major factor. Many hypotheses state that the flu started, the first outbreak started on military bases in Kansas between April and May of 1918. And then it spread quickly due to the crowding and the groups of people all living in close quarters together. So then the troops were sent off and carried the virus across the country and overseas after they were deployed. So they then spread the disease throughout Europe and brought it then back to the United States after it had mutated and gotten worse, because that's what viruses do. So we see the Red Cross workers here making masks to help prevent the spread, particularly in the armed forces, and they made more than 260,000 masks during the 1918 pandemic. So like I said, this bout of flu was alarmingly fateful. People died within days after exposure to Spanish flu, and it killed young people at an alarming rate, which was shocking. There was a very high death rate among 15 to 34-year-olds, which historically isn't the group you tend to see affected very much by viruses like the flu. It killed more people, both soldiers and civilians, than World War I. And while it lasted only a few months, it claimed 50 million to 100 million lives worldwide, including 675,000 in the United States alone. So looking at it scientifically and some of the research I was able to find about the Spanish flu, it's pretty much only a respiratory illness like most influenza, as opposed to COVID-19, which we're still trying to figure out what all systems of the body it affects. So influenza affected the lungs very severely. It replicated quickly and caused severe damage. So victims in 1918 experienced fluid-filled lungs as well as severe pneumonia and lung tissue inflammation. So the image on the left is an electron microscope picture of the reconstructed virus they were able to reconstruct in the mid-2000s. And then on the right is an example of the damage. Picture A is of just an H1N1 virus, something relatively common, whereas C is that same kind of virus with the parts of Spanish flu that made it replicate quickly. And that shows how much more damage it was able to cause within the same amount of time. So in response to the virus, public health measures then and now have been implemented to try to prevent the spread, keep people from getting infected, keep people from dying. So at the time in 1918, schools, theaters, churches, and dance halls in general across the country were closed. Kansas City banned weddings and funerals if more than 20 people were to be in attendance. And New York mandated staggered shifts at factories to reduce rush hour commuter traffic. And in Seattle, the mayor himself ordered his constituents to wear face masks. So one of the major factors in what made the disease more deadly in some cities than in others was when these measures were implemented. For example, St. Louis introduced public health measures within 2 days of the first reported cases, but Philadelphia waited nearly 2 weeks after the first reported infections to ban public gatherings. And there's a parade that was held before the bans were implemented that has been mentioned frequently. There's a whole podcast episode I was able to listen to about it. And people aren't necessarily sure whether that particular gathering led to an increase in cases in Philadelphia. but the fact that they waited so long to keep people from gathering was a major factor in the spread and the number of fatalities. So another factor, the result of the difference in the times was, so if we look at St. Louis, who waited only 2 days, versus Philadelphia, that waited nearly 2 weeks and held a major parade, the result we see is that the peak mortality rate in St. Louis was only 1/8 of that of Philadelphia. So it may not seem like a long time, but the difference made a major difference in the people who were affected. Another factor was actually when such restrictions were lifted. In my research from the National Institute of Health, Dr. Neil Ferguson is quoted as saying, cities that relaxed their restrictions after the peak of the pandemic passed often saw the reemergence of infection and had to reintroduce restrictions. So when we see talks now about flattening the curve and we see numbers go down, and as things open up more, we do tend to see more resurgence of people getting sick and more cases being counted. And that's not a new thing. That's one way diseases work. Unless it's completely eradicated, there's still a chance of spread, particularly in very contagious diseases like types of coronavirus and influenza. So you see masks did become a major fixture in everyday life, as they have become now in most places. Again, to prevent the spread, they were meant more to protect other people from getting it than they were to prevent the person wearing them from getting it. And some people question the efficacy of masks and whether they're just a personal safety, they make other people feel comfortable. But it didn't seem to hurt, at least. So in particular, I want to talk about Cleveland's response to bring it back to Ohio specifically. So Cleveland had a warning by September 22nd that there was a good chance Spanish flu was coming, but they didn't act until October 4th. The planned response called to isolate those with symptoms in a contagious disease ward at City Hospital. Employers were also encouraged to have their workers go home if they were symptomatic, and schools were monitoring students and sent home symptomatic children. The students that were then sent home for illness were reported to the health department so the families could be monitored in a sort of contact tracing. And the Cleveland Railway Company ordered its motormen to assist in the arrest of all passengers spitting on their streetcars. So this was taken very seriously at the time. On October 10th, 1918, Mayor Harry Davis announced the decision to close all theaters, movie houses, dance halls, night schools, churches, and Sunday schools across Cleveland, effective October 14th. The saloons, pool rooms, and cabarets were not included, and schools were kept open under the belief that students could be better monitored in classrooms as opposed to at home. The plan specifically for schools was as long as fewer than 20% of the students were absent, they could stay open. But if the overall absentee rate for all schools resulted in 10% of total enrollment, the entire Cleveland school system would close its doors until the epidemic had passed. And the schools closed almost immediately. There were almost 300 students suspected sick, and while many students actually skipped on the day they started the counts in the hopes that they would close schools, there was a plan to reopen the schools at that point, but enough students actually developed the flu that the schools stayed closed. In regards to how serious they took this, police took this very seriously. There are stories about a card game at a cigar store being broken up to prevent the spread of flu, and not because the men were gambling, despite what they told the police. There's also stories about people being arrested at synagogues for gathering to worship, as well as a candy store owner and 6 customers being arrested for congregating in the store. Things started looking better by November 1st of 1918, and by November 5th, some of the restrictions had been lifted, such as downtown businesses being able to stay open until 6 o'clock as opposed to 4:30. The closure order and gathering bans were to be lifted on November 11th, with schools opening on November 13th. And this is kind of where the research starts to fall off. By about mid-December, 12 schools had closed temporarily, but the rest of the school system didn't need to close again. So looking at the numbers from late September through the end of the year, 23,644 residents of Cleveland fell ill, with nearly 1,600 of them developing pneumonia. 3,600 people died of either influenza or pneumonia that autumn, with an additional 800 deaths in January and February of 1919. So when looking at statistically, they claim about 3.5% of the city's population came down with influenza or pneumonia, and 16% of that 3.5% died. So the rate in sheer numbers, they say 474 per 100,000 people died, which was the highest rate in Ohio. And it was actually worse than either New York City or Chicago. So some of the delays within Cleveland's response probably played a major factor in the number of people who were infected in the city. And to bring it even a little more local, we'll look at Warren, Ohio. So in Warren, by October 11th, there are newspaper articles reporting these statewide closure orders from Columbus. So the statewide order closures specify that theaters, cinemas, schools, and churches all close. All indoor meetings are prohibited, but outdoor meetings were allowed. And there were steps to prevent congregating and loitering in pool rooms and saloons. Those spaces were kept open mainly because a lot of working class people went there for a meal after their shift kind of late at night. And there were rules instated that they could still sell alcohol as long as it was bottled in a sealed container for people to purchase, and then consume off premises. And in the same page of the newspaper I was looking at, there was actually a report that Southington schools closed on that date after 9 reported cases. So the very next day, there's a small article discussing that there is no flu in Warren. And then on October 22nd, there was a reported 23 cases and 1 death. At that point, the Warren City Board of Health was asking for $2,000 to meet the financial needs of this emergency battle. And they report that Youngstown already has 2 emergency hospitals and will have a 3rd. October 29th, the bans get a little more restrictive. Stores are required to close at 6 o'clock, and all depots must be fumigated. And then the reports jump ahead to early December. So on December 2nd, there are reports about meetings trying to make decisions about the bans, whether they will be tightened and become more restrictive, or whether the bans will be lifted. And the next day on December 3rd, it's reported that the bans are still in force. And to connect this to the Sutliff family specifically, while there are no reports that anyone specifically in the family died of Spanish flu, Edward Sutliff Brainerd died of severe illness in 1918. We don't know for sure if it was Spanish flu. The obituaries just say it was severe illness and it was sudden, but it's entirely possible that he died of Spanish flu and was one of the fatalities among it. I thought this picture was interesting of the barber shaving the maskless customer, sort of similar to the trend we see towards people going and getting haircuts and things now in our current time. So to wrap up, the focus of this, or what I got from this, was really, we've seen this sort of thing before. It's not very new. We've seen rates of illness fall for there to be a resurgence later, whether that's due to the responses of the governments, the weather, or just the way the virus goes. Some viruses will just ebb and flow like this. Ohioans have been through this before, and many survive. that doesn't mean this isn't serious and it'll just go away. But it's interesting that we still reference a flu pandemic that happened 100 years ago, and especially looking at the responses to it. Each person doing their best to help keep themselves and everyone else safe and healthy worked before, and it'll work again. It's scary now, and people in 1918 were scared too. But we can get through this.
All right, at this time, we're going to open it up to any questions. Like we said at the beginning, if you can type it in the chat box, and we'll try to answer it as best as we can.
Thanks.
All right. One is, do you know of specific treatments that were given to patients in 1918?
From my research, I can remember quinine was actually used, I think, to help treat it. Sort of the idea that malaria, the same idea that like it was used to treat malaria. I saw champagne as well, which was a fun treatment, but it didn't do anything. It was interesting. A lot of things were just try whatever, throw whatever at the wall and see what sticks. But yeah, not much really worked until we kind of figured out what it was. At that point, it was trying to prevent the spread and hope anyone who got it did well and was able to survive.
Okay. Any other questions? All right, well, just to give you a heads up, our next presentation will be on Saturday, November 14th, and we will be discussing Victorian decorating, and specifically in regards to Christmas decorations. We are working on a take-home kit if you so choose. It would be to make your own Victorian ornament. So keep a lookout for information on that in either our digital newsletter or any of our social media. And thank you very much, Beverly, for your work and for the presentation. And thank you everybody for joining us. We hope to see you on November 14th at 2 o'clock, and have a great rest of the weekend.